It is the men and the women in our medical communities who have really learned some of the countless lessons that are aimed at keeping all of us safe. I spoke with the program manager of Providence Sacred Heart's Special Pathogens Program this week to look back at the impact she has seen over the past year.
That day, in many respects, feels surreal.
As she looks back 1 year ago to a press conference discussing the first coronavirus patient's arrival in Spokane, Krista Arganchona says that day in February of 2020 is still very vivid in her memory. Arganchona says she prepared for that day by digging through some of the educational material from 3 other hospitals across the country who had taken in the first Ebola patients during the 2014-16 outbreaks.
I think I felt a lot of the things that they felt as well on that day, just because there was so much concern and fear and questions because we just didn't know much about this pathogen.
Within a month, Arganchona's unit was shifted into a COVID ICU unit, working desperately to learn and grow and shift their priorities as much as possible.
That part was really challenging, learning something new and then educating everybody to it. And then all of the caregivers throughout the hospital adapting to that.
And as our entire global medical community worked around the clock to learn more about the virus over the next year, Arganchona says she watched as her crew members at Providence Sacred Heart transformed their ability to adapt into a new sense of compassion.
I think there's an increased level of appreciation for each other because we've all experienced that same level of fatigue and really the endurance that it's taken. And, we're not done, so I think that's been pretty inspiring to watch.
Looking ahead now, Arganchona says she believes the past year has really stressed the importance of having a well-prepared plan for the future, including more PPE supplies more readily available. And the past year has also shown Arganchona some added perspective in our current medical scene as a nurse and a mom, since 2020 saw her daughter enter the medical field as well as a new nurse herself.
Watching her on board into the medical field in the midst of this COVID pandemic, I said, hey, this is your chance. I said, we need people like you, and we really do. We need those compassionate, energetic people to enter into medicine. It's an amazing field. And looking back over this last year, I've been a nurse for over 30 years, and I look at everything I've learned over this last year has really been amazing.
Now, I also asked Arganchona as we looked back at that press conference 1 year ago and asked her if she had any advice for herself, for her fellow panelists, even those of us journalists who were asking some of the first questions about the coronavirus. And she says she would have given all of us the same advice, which she says is very applicable today, to pace ourselves and to trust the science of this process. It's crazy, Jeremy, to look back. We didn't know each other a year ago, but
we did not.
We can all probably remember something about that day.
Yeah, totally.
Yeah.
What a wild year it has been. And you think about some of the things that have changed where I'm kind of just the person who's taking it one day at a time and trying not to think about the overwhelming change.
Pacing yourself.
Yeah, pacing myself. But I haven't seen my family. And this is the longest I've ever gone without seeing my family.
Well, we'll all get there.
Hopefully someday.